Hello, welcome to the Medical Maze. I'm your host, Donnellen Ray, and today we're going to be talking about sarcoidosis with my special guest, Terri Vickers. But before we get started, let me say hey to my co-host, Phil.
This is something that I've never heard of before. So we've got one that is brand new. So if you're watching this for the first time, you're going to learn something very, very valuable.
Yes, I think so. And Terri, welcome. I'm so glad that you could join us.
Thank you.
So sarcoidosis, the million-dollar question, what is sarcoidosis?
It's a condition that involves your any part of your body, really. It's characterized by the growth of tiny collections of inflammation, and they are like nodules, and they call them granulomas. It's kind of rare. There's maybe 200,000 people in the U.S. at one time that has it because it can start and stop.
Okay.
And nobody knows why. There is no known cause for it, and there is no known
Cure or something?
for it. Yeah.
So is it an autoimmune thing? Is it like...
No, it's not autoimmune. It does make your immune system overreact.
Okay.
And it has immune responses, but it's not considered an autoimmune disease.
Okay. So when were you diagnosed with it?
I was diagnosed in 2016. I was walking into my job at the time and going up the stairs, and it felt like I was walking underwater. I couldn't breathe, couldn't catch my breath, and I was concerned because it happened many times. And I went and saw my family doctor, and he sent me for an x-ray. And through the x-ray, they saw that there was like spots. There's things on my lungs. So he immediately got in touch with a pulmonologist, and they had me in the hospital having a bronchoscope within a week.
Oh, wow.
And
so
through that, we did a biopsy, and they found it.
Oh, wow. So I can imagine seeing spots and stuff. That'd be scary. Mm-hmm. Phil, can you bring up that chart? Because you said, so this was in your lungs. Uh-huh. So these granulomas, and if we look at this chart, it looks like that it's common in a couple places or a few places. I think you said you can get it all over your body. Mm-hmm. But so you got lungs, and then you have lymph nodes and skin?
Yes. And brain, heart.
Wow.
Anything that goes through the lymphatic system.
Wow.
Because it travels that way.
Okay, and so for you first noticed it in your lungs.
Yes.
And it made you, it was hard for you to breathe, and you couldn't. And so they did this biopsy. So were they familiar? So they didn't misdiagnose you. They did the biopsy, so they told you exactly at that point what it was.
We thought it was leukemia.
Oh, wow.
That's why they went so quickly, because they were afraid that it was leukemia.
Oh, my.
Which is one of the common misdiagnoses.
Really?
For it, yeah.
Wow.
Yeah.
Okay. So then, so you had the biopsy, then they knew immediately what it was. Mm-hmm. And then what did they do? How did they start the treatment with you on that?
They just started doing drugs like methotrexate.
And what kind of drug is that?
It's
That's okay.
Anti-inflammatory, I think.
Okay. Okay.
That's a steroid, though, isn't it?
Okay.
Probably.
Okay.
They did steroids and all that stuff. And we weren't having very much success, so my pulmonologist sent me to Mayo Clinic for a specialist there.
Oh.
And he put us on azathioprine and prednisone and a whole schedule of what we needed to do. And that was, in 2016, so I don't really remember too much what they had me on. But
okay.
I get very susceptible to like bronchitis and pneumonia. In I think it was 2017, I was 2 weeks in the hospital with pneumonia because it just tears. When I get any kind of lung problem, it is just intensified because of the sarcoidosis.
Oh, wow. Okay. So, even is like a cold or anything that stresses your respiratory.
Kids go, don't go.
Oh, right. Yeah.
If you're sick, stay home.
Oh, God bless them. Yeah. So has yours primarily been your lungs, or have you had other places?
I have it subcutaneously. I get nodules under my skin.
Okay.
I've had 6 surgeries to remove the nodules because they get enwrapped in my muscle or nerves. So then it's very painful.
Oh,
I even
wow.
had one that was very, very bad, was on the bottom of my left foot,
Oh, wow.
and had to have that removed.
So they just removed the whole thing, but what's the likelihood of it coming back?
The one on the bottom of my foot, I don't know if it's scar tissue or if it's actual nodule coming back, but it comes back.
But it could. It could. Okay. What's the most, is there a more common place? Lungs or skin or some?
Lungs is usually the most common.
Okay.
They say in the U.S. anyway, the involvement of the eyes is mostly African American. Japanese people will usually have more heart related
Okay.
sarcoid, and for Caucasians it's primarily lungs.
Really?
For
Wow, that's
Eastern
interesting.
Scandinavian people.
Okay. Phil, can you bring up that chart? I think we talked about, I think in here we have,
Keep going.
no, that's a good thing. I like the point on here about where it's called the snowflake disease.
Yep. Yep. Because everybody's different.
Okay.
Everybody has different symptoms.
Uh-huh.
So not two people with sarcoid will have the same symptoms.
Wow.
That's got to be really hard to
That's why
pinpoint.
it's so commonly misdiagnosed.
Oh my goodness. Because I was thinking when you first said you were having lung issues that they probably said, oh, you've got pulmonary, you got not embolism, but oh, your kidneys are bad, or you have congestive heart failure, or something like that. Did you get that when you were?
No, because it was just like he just sent me straight for a X-ray just to see what was going on, and then he saw the spots, and then he got me right to pulmonary.
Or you said they thought it was leukemia. That's scary.
His first thing, and he called me personally, and my doctor has never personally called me.
Well, that's
And
not good
he's
then.
like,
Huh?
I need you to go do this, and he's like, it could be leukemia, and
Oh my.
that was like terrifying. And then to have to do the bronchoscope, and they have to put you under. It's just like a surgery, and it was horrible.
Oh, I
really
bet. I
scary.
bet. How scary. Yeah. The chart, can we show, I think there's where it talks about the different areas. Can we go back one?
Oh, this one?
Down one, I think. Well, I confused myself. Okay, yeah. So here, so go back to the one where there was a picture, because I think that's an example of it in the skin, because you were saying it can go into the skin.
I got some right here.
Hold on. So your arm?
Yeah, right here.
Wow. Okay. And it's just like that's the first. It's the bumps, and so you feel the little nodules under there. Is that
I
it?
got one starting right here.
Oh, okay.
So it's hard. You can't like pop it or anything.
Yeah, it's kind of soft. You can feel it.
Can you pop it? Like,
Oh, huh.
No.
Is this almost like a cyst kind of feeling? Yeah.
So they thought I had a cyst here, and I ended up it was a nodule. So
Okay.
we had to have that removed.
Okay. Wow. Okay. So then let's go back, because I want to talk about some of the symptoms for some of these other areas in case someone may be having something and they're just not sure. So the general symptoms, well, I guess you were having the fatigue and just the respiratory issues because yours was in the lungs, but it
I
says,
certainly didn't get the unexplained weight loss.
so it says fever. I mean, some of these things could be,
Right, could be
lots of
anything.
things. Yeah. Fatigue, joint pain, muscle.
aches or weakness.
Thank you. Night sweats.
Yeah.
Who would have thought? Swollen lymph nodes, because you said the lymph system was an indication. Unexplained weight loss, yeah. And then the kidney stones.
Yeah.
Now, isn't that
And
interesting?
I've never had those, thank goodness, but
Huh?
yeah.
Because who would have thought that maybe I have sarcoidosis, I've got a kidney stone or something, and I'm a little tired or something. Yeah. Now, if it's in your lungs, and this is where you were, cough, shortness of breath. Were you coughing?
Yeah.
Okay.
I still have that.
Oh,
chronic dry
really?
Cough. Yeah.
Okay. So you did have the shortness of breath for sure. Chest pain.
I didn't experience that, but it makes me wonder because, in 2005, 2006, I had a heart attack.
Oh,
I'm
wow.
wondering if that was part of this as well.
Oh, wow.
Made me think after we were researching stuff for this show. I was
Could
like,
that
oh man.
Yeah, maybe
could've
because you
been.
were. I'm not that there's necessarily an age limit on a heart attack, but you would have thought, well, you're
Yeah, I was
fairly.
only 35. so,
Yeah. Wow, isn't that interesting? And so now you go back and go, maybe. Now, I mean, I know I have it now, but what?
Yep.
Wow. Yeah, that's interesting. Okay, so
I have a question though.
Yeah.
How is your immune system though? Because these seems I was thinking, oh, what happened during 2020 when everybody in 2021?
I
with-
was
with COVID?
fine. I mean, as far as my immune system goes, it's not so bad because it is not an autoimmune disease. So when I'm taking certain medications, that's when my immune system is more affected than just when I'm not taking medicine. So
during COVID and stuff, then
yeah,
it
I
wasn't
was
a
fine.
bigger.
I just
Okay.
did the I did the vaccines, and my doctor. Every year I have to do flu shots and pneumonia shots.
Oh,
and
okay.
all that stuff.
That would make sense
So-
to just to whatever immune system boost that you can get to try to not get those. Okay. Wow. Okay. So then I think the next one was the eyes.
Oh, go back. Okay.
No, you were good. The eyes in the eye, which is interesting. Yeah, back one. Bottom right. Yeah, there we go. Blurred vision or loss of vision. Okay. Eye pain. Probably wouldn't have maybe thought about that. Red or swollen eyes or conjunctivitis if you've got your grandkids,
Yeah,
who knows?
Right. Because they get that.
Yeah, exactly. And sensitivity to light. So you're kind of like, wow, I don't know that I would have thought.
You don't
you know,
connect it to.
Yeah.
Yep.
But I guess if you are having these or you're having these symptoms maybe repeatedly, then maybe that's when you need to maybe
Yeah,
kind
'cause
of.
I had cataract surgeries already.
Yeah.
When I was in my 30s, I had to have cataract surgery.
Wow.
And it's just crazy. All these things that when I'm looking up stuff to talk about today, I'm like, man, I wonder if that was related.
Yeah, I was going to ask you when you go back and think about all the things that you've gone through, because you were 16, right? How old were you when you got diagnosed?
In 2016.
In 2016, sorry.
Yeah. So it was a while before and you had all those things happen before then. Wow.
Yeah, so you're probably wondering, okay, well that
Yeah.
checks the box, and then
Yeah.
that checks the box.
And that's what I was like, dang, this could have been this all along.
Yeah, because cataracts in your
30s.
30s?
Yeah.
Wow.
How was your vision back then?
I've always wore glasses until I did LASIK.
Wow. Knowing that now, like, do you have like some relief with that, or do you?
Well, yeah, because then I'm like, okay, well, it wasn't my body; it was this disease,
Mm-hmm.
and it could have been misdiagnosed all this time because we never connected the dots and never had any reason to think it was that.
Wow. Yeah.
Donnell, and this says that I'll put the chart up here
Yeah.
again.
Mm-hmm.
It says that the exact cause is unknown. It could be genetic or environmental.
Correct.
Like, so this you couldn't got it from a bacteria or a virus.
I don't think so.
We don't even know.
Well, yeah.
We don't know. Yes.
Yeah.
That's the whole thing. And I don't know of anyone in my family that has it, but my sister has Crohn's disease, which is definitely Crohn's, so it wasn't misdiagnosed for that. But
Is that misdiagnosed Crohn's for Crohn's?
that's one of the things that are commonly misdiagnosed from sarcoid.
Oh, really?
Crohn's, tuberculosis.
I guess I can maybe see more tuberculosis just because of the respiratory stuff if it's in the lungs, but Crohn's, wow. Just kind of like the leukemia. I mean, you're like, wow, what a place to
really
go.
scary.
Yeah, sure. Yeah. Okay, so what about the one for the heart? What are the symptoms for the heart? And just for anyone listening, we are going to put these will be as part of the podcast. So if anyone wants to go and see them later, so if they don't get all the symptoms now, you can definitely refer back. But chest pain, fluttering heart palpitations, heartbeat, irregular heartbeat, heart failure, shortness of breath. Well, and shortness of breath goes back to your lungs too. So you either one. And with heart disease being such a prevalent,
It's very common.
condition in our population, you may not even have thought who would have gone and said, you know what, maybe it's not that, maybe it's sarcoidosis. Sure. Yeah.
You guys want to know how many people in the U.S.? Well, actually, it's not U.S. And yes, in the U.S. So about 10 to 40 people out of 100,000.
Yeah.
So between 10 and 40 out of every 100,000 people.
And those are the ones that have probably been diagnosed, who know that they have it. What about maybe those that think that they have something else? You know?
So I'm thinking your doctor helped you really because I'm thinking not everybody would have been like, you need to get tested for this. They kind of would have been treating the other things first, and who knows how long your suffering would have gone without being treated for that.
My doctor is very cautious, so and he has been my doctor for probably over 30 years now.
So I guess do they send you to a doctor based on where it is? Right. Like they sent you to a pulmonologist because it made sense. It was lungs. So do you go to a dermatologist then for skin?
I do not see a dermatologist. I see a rheumatologist.
Oh, okay.
Because they have to monitor my blood work and stuff like that. So because the medication that I'm on is usually related more to rheumatoid arthritis.
Oh, okay.
So my pulmonary doctor set me up with the rheumatologist, and I have to see them every 3 months and get blood work every 3 months, and they adjust my medications based on the levels because they affect the liver. So now
okay,
I'm having, to check the liver all the time because of the medications I have to take to keep the sarcoid from flaring up.
Okay. So you're not seeing it for the spots or the cysts that you have?
I mean, I see a hand doctor.
A dermatologist, there's no one you're seeing. Okay. But your rheumatologist are they managing that?
Yeah.
Okay.
Yeah, I see the rheumatologist, a cardiologist, a pulmonary doctor, and then my family doctor. Do you feel, and of course this is your opinion, do you feel that there's knowledge about it in the medical community? No. Most of them don't know. I tell them I have sarcoid, and they're like, "Oh, okay.
Let me go look that up."
Yeah, probably.
Yeah.
Because they don't, my doctors do because they see me, but
yeah.
When you go to like the emergency room, it's like.
So you happen to, it sounds like that you happened to find a doctor who knew about this condition, and or at least sent you to someone they thought would at least diagnose you properly or find something, and it doesn't sound like that. Maybe that's everyone's experience because they're on maybe heart disease, or they're on leukemia, or they're on Crohn's, or they're something else where because they weren't familiar with this.
Without the biopsy, we would have never been diagnosed with sarcoid.
But can you imagine being treated for something like leukemia or whatever? But there's tests out there for that. But I'm just saying something much more severe, and then you're wondering why maybe it's not helping like it should.
Right.
It's just a thought. I mean,
it's not like this disease hasn't been around. It's been around. It's been tracked back to like 1846.
Oh,
was
wow.
the first case. So.
Wow. So it has been out there. It's just a matter. It's just
people don't.
It's not common enough that it's maybe in the medical community. That's not something that they maybe study in school, or they just don't see a lot of people with it, so they're just not as familiar.
What happens if this goes untreated?
I'm not sure. I suppose people would be not being able to breathe, or heart attacks, or.
Well, is it something that could eventually lead
to death?
Yes.
I would imagine. Okay. Yeah.
Because if you're not treating those symptoms, say, of a heart or the lung, or you can't breathe, or
especially the heart or eyes.
Yeah, can't see or something. Yeah.
Sounds like diabetes.
Yeah.
Oh, yeah.
It's got diabetes symptoms in there. Mm-hmm. That's what it sounds like. And so, I would think this is probably one of the most misdiagnosed things out there if you're not educated on it.
Yep.
Mm-hmm. Mm-hmm. Wow. So can you pull up the chart on the treatments too? Because I think that you said that. So how it's treated, all these symptoms and stuff. So, so let's go. Oh yeah, on the one of the skin. I'm sorry, I forgot the. It says of the nervous system too. Sorry,
Which one? Go back.
Yeah, sorry about that. I forgot about the nervous system. So that's interesting because you talk about diabetes, increased thirst or amounts of urine. There you go. And then Bell's palsy. Isn't that interesting?
What's Bell's palsy?
It's like it almost
Paralyzed in your face.
yeah. It's like part of your face is paralyzed, and I know someone that had Bell's palsy,
Alice.
and they thought, of course, the first thing is, oh my gosh, I'm having a stroke. Because all of a sudden your face droops, and it takes it a while to get to heal or whatever, to get corrected. Where you can still have a side that droops or maybe a mouth or whatever, but at first you want to go, oh my gosh, this is sign of a stroke.
Right.
So it can give you Bell's palsy. So who would have thought about that? To go and a sarcoidosis for something on your nervous system. I wouldn't have thought about that either. And then we did talk about the skin, so you'd like the bumps and everything on the skin.
Tattoos and
Growths under your skin around, what was it, scars and tattoos? Yeah.
This is finally healed up, but I had this tattoo back when my mom passed, and that's been many years, and I got like little bumps underneath it.
Really?
What the heck is that from?
Is it because I don't know, I'm just throwing this out there. Is it because the skin's kind of damaged there from the tattoo? Is that it?
Yeah.
Okay. Wow.
Is that painful?
Yeah. Yes. When the nodules come in, they're very painful.
So it will hurt putting on a shirt or anything like that, and is that all over your body or is that just
no?
your
I've only experienced in my hands, my arm, around my knees, and my feet.
So all the places that get a lot of contact.
Yeah.
Yeah. Okay. So okay. So the treatments. I'm sorry, I had forgotten about the other areas that it can pack because nervous system. That's interesting. So then, like you're saying, well, and I thought this point was interesting too, where it says it may go away by itself. Mm-hmm. Is that more skin? Because I can't imagine, would your lung kind of go away?
Every year I have to have a CT scan with and without contrast. In the last couple of years, it's come back fairly good. No new growths, no inflammation. So
okay,
it's in remission.
Okay,
kind of.
Okay,
and it stopped growing nodules, but then all of a sudden you'll get a nodule, and I have these little bumps around my ankle, and my doctor, the pulmonary doctor, said that was one of the signs of the sarcoid that comes and goes.
Wow.
Yeah.
Do you think it's stress? Does stress bring it on, or I don't know?
No, because I've had some pretty stressful times here lately, and I haven't had any flares. So.
Gotcha. Okay. So does an inflammation? So it can cause a lot of inflammation. And because we had talked about this on a different episode about anti-inflammatory diets, have you noticed that anything like that helps? Certain foods that help reduce inflammation? Yeah. No. Okay. Mm-mm. Okay. So it's pretty much we're dealing with, I guess, the medicine. So your methotrexate, is that it?
They did methotrexate before. Right now I'm on leflunomide and hydroxychloroquine. That helps keep the nodules from fully forming.
Oh, okay.
So, isn't that what everybody was taking with COVID?
The hydroxychloroquine?
Yeah.
I think so.
Yeah.
I think so.
Good memory. Yeah.
Wow.
So the like prednisone, so your steroids, the immunosuppressants. So that's
when I take those, that's when I'm more susceptible to everything.
Yeah, and that's when grandkids. Yeah, if you are sneezing, sniffling, anything, don't come over. Home. Love ya, but
exactly.
But not today.
Because that takes me to the hospital.
Yeah,
it's most people can fight that and go on with their life and just have a cold. I can't just have a cold. When I get a cold, I have a cold, and then it goes directly into bronchitis.
Oh wow!
And then if I don't catch it, I have to go to the doctor immediately, within a few days, or I'm in pneumonia.
Wow. So, would the sarcoidosis could it cause lung damage, or is it
yeah.
the pneumonia that would cause?
The sarcoid itself can cause fibrosis or scarring in the lungs.
Okay.
So I'm sure the pneumonia doesn't help it.
Yeah. Yeah.
So.
I just didn't know if it caused it or if it was actually the symptoms or the.
Well, because you have the nodules in the lungs, so
Okay.
that causes a scarring and fibrosis.
Interesting.
So how did you handle when the world was on fire with COVID? Like, because
I
you
just
had
stayed home.
you stayed home.
I stayed home.
Yeah, because you were saying that your other medicines cause your immune system to.
Yep.
Bottom out, yeah.
We didn't go anywhere. My husband and I, neither one of us got COVID during that entire time.
Because you just
we stayed home. Yep.
Wow.
Because we worked remote. Well, I was able to work remote.
Mm-hmm.
They closed down our office and
Yeah.
for months. And
Yeah.
So we just stayed away from everybody.
Well, and that's not just the COVID issue; it's a whole other health issue for you on that. Wow. Yeah. Yeah. So, are they working on a cure for something? I know there isn't one now.
I know the Foundation of Sarcoid Research. They have several studies going on at all times. They work at a global level, and they're trying to understand what causes it so that they can then find a cure for it. But nobody has gotten to that point yet.
Hey, Donnell, and I got a question about these type of diseases. They don't get a lot of funding, do they? Because they're rare. Is that what happens?
Yeah.
Unfortunately, yeah, I think that happens. Because there's all those that have just a higher prevalence. Then you get more. Cancer research
cancers,
and things like that. There's a
heart
lot
disease.
heart disease. Yeah, there's just bigger prevalence of them, and I think that's where the money goes because you can affect a wider percent of your population, and then those that, and that's another question. So, the future for you with this is it's just going to be a chronic thing. You just have to keep treating it as it comes up with the medications or whatever.
And hopefully, I don't develop any kind of liver disease from the medications.
Oh gosh, yeah.
Because they all flow through the liver, so then you're taking chances with the liver. So
Do you take a lot of pills or injections?
I take pills, medication,
You have a number?
no shots.
You have a number of how many pills you take a day?
I take seven prescriptions a day.
For the sarcoidosis.
Some's for that, and some's probably related.
Yeah,
So,
that you have to take to counter affect something else to make sure, say your liver or whatever it is. Wow. Okay. And this is
constant blood work and
yeah.
CT scans, and you have the CT scans with contrast, so that causes its own problems.
Is it just
The contrast isn't good for you.
Your kidneys.
because of the
Kidneys, yeah.
but you're not allergic to it, so thank goodness.
no.
Okay. Okay.
No, but I'm messing with my kidneys now because
Sure.
of the contrast. So
Wow. So this is what the future looks like for you. Is just going to continue treating this. So what about prognosis long term? Does it take its toll on the organs, or is it? And I'm sure it's probably different for each person.
and it can. I assume it's based on what type you have.
Yeah, where
what
it is.
medications you take, and
Yeah.
because I stopped taking the steroids. I told them you're gonna have to find something different because it made me gain so much weight when I was on prednisone, and I couldn't afford to keep gaining weight. So 'cause that causes more problems elsewhere.
Sure.
Now I've been diagnosed with type 2 diabetes because of weight.
So that's when they put on the drug you're on now, the metho.
No, I take leflunomide and hydroxychloroquine.
Okay. Do you feel like those are helping? So,
Yeah.
okay.
How do your doctors, do they all communicate with each other?
Oh, yeah,
Because,
yeah.
one med may interact with another med that treats something else, but this one may help, but it also may interact with this, with your diabetes.
Right. They all coordinate through my primary care. He gets everything. So we have a good system in place because I don't change doctors. My primary I've been with him for 30 years. My pulmonary doctor I've been with since 2016. My cardiologist I've been with since 2005, 2006. So I just stay with the same doctor so that there isn't any problems.
How many appointments do you think you go through in like a month?
Right now, because I'm not under a flare, it's not so bad. I just see the rheumatoid doctor every 3 months. I see my pulmonary doctor every 6 months, and then I see my primary, normal amount, twice a year, and then my cardiologist once a year. When I have a flare, then I'm doing all kinds of things. I still have
probably
to do,
something every week at least.
every 6 months I have to do a pulmonary function test. So if there's a flare, we'll catch it hopefully early, and then I would be doing those more frequently, and more CT scans and such. So right now we're on a pretty maintained schedule. So
Wow.
yeah.
Wow. So that's a lot. That's a lot. And then you just, and you don't dare wait to go to a doctor on it with a cold even.
Oh yeah. If I get a cold, I usually end up going to the CVS quick care.
Yeah.
Because I can get in there fast and
Yeah.
get medication, antibiotics and stuff. So.
Yeah. Wow. So what do you think, besides talking about like we are, do you think that there's anything that folks can do for people like you to help with this? Because, I know I'm not sure how much awareness is out there. We're already thinking that maybe the medical community, because it's not as common, maybe a lot of them aren't familiar with it. So is it education and...
Would have to be education because it is out there. There's 200,000 people at one given time in the U.S. has it. So it's not...
And then sometime in the 1800s is when it was first...
Yeah, so it's been around. It is around. And, education and just talking about it helps get it out there, and hopefully they'll find a cure for it in my lifetime anyway.
Yeah, absolutely. Well, thank you so much. This has been really, really enlightening. Websites or places that you would recommend people if they want more information, you mentioned the Foundation for Sarcoid Research. Oh, great. Thank you, Phil. Cleveland Clinic, because they have an explanation on it.
Mayo
the Life
Clinic.
and Breath Foundation. So Mayo, yeah. And then I guess depending on what area it is, maybe the associations, associated with that, like the lung and the eyes and the liver or wherever. So that's excellent. Well, I just appreciate your time today. And this has been really, really enlightening. Yeah. Thank you.
For having me.
Absolutely.
All right. Phil, you have anything else?
One thing I need to say is, guys, make sure you check out our website. It is medicalmaidspodcast.com. Everything is up there. Previous episodes, blogs for each episode. You can follow us. You can register as a guest. Everything is there. So until next time, we will catch you later. Bye, guys.
Bye.